system, digestive system, the second group of the urinary and reproductive system. Okay, he will show us this organ. So here we start with the respiratory system. So here the trachea, we recognize it, rings, right, of cartilage. Okay, up here would be what? The larynx. So this would be here, the thyroid cartilage. Okay, so it's open here, and inside you can see those folds. Vocal cord. Okay, in the larynx here. And but what we need to identify in this one here would be the larynx, and down here the trachea. And we do remember the trachea is made of C-shaped rings of cartilage. They are not complete on the back, so if you turn this around, then you see here just muscle. Okay, so cartilage, and then that continues here, and down here it will split into the two primary bronchi. You see them here? So here I'm penetrating. So that would be here. One will be going into the left lung, the second one goes into the right lung. Okay? So trachea, that would be main left bronchus, and this would be here the main right bronchus. Okay? And the lungs, we see them here on both sides of the heart. So one big difference between cat and human, that the lungs are subdivided into many, many lobes. You see here, smaller. And on this side here, you also have several of those lobes. And so 1, 2, the bronchi 3, the lungs 4. Those are the 4 organs for the respiratory system. Digestive system. Digestive system, we ignore here the oral cavity. We start from the esophagus. So right behind the trachea, the esophagus is located. So you move it to the side, and here is the esophagus. Okay. So esophagus, you can also follow it here. It goes, you move these lungs to the side. Okay, so that's it here, continuous. What is this here?
Liver.
This here.
No, that's the lung.
That's the diaphragm, right?
Diaphragm.
So the diaphragm, and you follow it here, the esophagus, it pierces the diaphragm here. And from there, it is in the abdominal cavity. And this would be here, the same esophagus here. Okay, so esophagus here, and it gets in the abdominal cavity here. As soon as it gets in the abdominal cavity, that esophagus enlarges and becomes the stomach. Okay, so we have the stomach here. So with the typical J shape or C shape, okay, stomach. So recognize here the fundus, the body of the stomach. This would be what region? The pyloric region, right? On this side here, we have what curvature? The greater curvature, and from the greater curvature we have the greater omentum, right, hanging down here, and then on this side we have the lesser curvature, and here we only have a remnant of the lesser omentum connecting the stomach here to the liver, right? And as the stomach narrows, it becomes the small intestine. What is the first part of the small intestine? Duodenum, right? So this would be here, the duodenum. Now, there is no anatomical distinction or macroscopically, at least between duodenum, jejunum, and the ileum. So, if it's closer to the stomach, that's one way for you to know that it is the duodenum. And you follow here the duodenum, and eventually that would be the jejunum. So again, there is no anatomical landmark where you say this is where the duodenum ends and the ileum. But histologically, we learned to differentiate those last time. So we continue here. And the jejunum eventually becomes what? The ileum.
Doesn't the blood vessels go to it differently?
Yes, the blood vessels go differently, and that also one way you can do, but that would be through the mesentery, not on the small intestine. Okay, so we're looking at these mesenteries here. Okay, so we continue here, and eventually the small intestine will end and become the large intestine. See here? Difference in diameter, small intestine, large intestine. First portion of the large intestine is cecum, and the junction here would be the ileocecal junction between the ileum and the cecum here. So the valve would be at this junction here. And once you find the large intestine here, you can follow it large intestine going down. So not as long as human. In human, remember, it goes from the left inguinal area here, it goes up, across, down, and then we have the sigmoid colon before becoming the rectum. But here, very short. And that's typical for carnivores, having a short digestive system. So this will be here at large intestine. And large intestine here will end with the anus. And other parts of the digestive organs would be the liver, right? So liver here, we also see it mainly on the right side of the body, but multi-lobe, not only two lobes that we see anteriorly on human, but see here many, right? So this is all the lobes of the liver. And then somewhere here we have the gallbladder. Right? So this sac here is the gallbladder, and if you follow it here, you can find the cystic duct where it connects to the common bile duct. So those are the organs of the digestive system. The pancreas, remember, is, even though we studied it with the endocrine system, it is still part of the digestive system, right? So the stomach here reflects the stomach, and here's our pancreas. Okay, so the pancreas here. Urinary system. Urinary system, we have kidney, the second one here, and we see how it is wrapped by a bag. What that layer would be? So this is here the dorsal wall of the parietal peritoneum here covering. So the kidneys are behind the peritoneum, that's why we say they are retroperitoneal. Okay, so we see here. And you can see the adipose tissue around it here. You see it? The adipose capsule. So on the back here, I have to cut it, but that would be here, the renal fascia, attaching the kidney to the posterior tissues. Okay? Below the renal fascia, you have the adipose tissue, which is called the adipose capsule. So on this one here, we have opened the kidney, so okay, so we can see the cortex, right, and the medulla here, and down here would be the pelvis. You see here the cavity of the pelvis. Okay, so cortex, medulla, and the pelvis, and this would be here the capsule. Okay, so removing the capsule. So adrenal gland would be medially located, so this would be here the adrenal gland. Okay, so here, in human, the adrenal gland rests above the kidney. In the cat, it is medial to the kidney. Okay, and we saw that also with some of the cats with endocrine system. That would be it here. And from the kidneys, extending down is what? The ureter. So we have one here, and then we have the second ureter here going down, and we see that both are attached to the urinary bladder. Okay, so on both sides here, urinary bladder. So urinary bladder here, and from the urinary bladder extending out is the urethra, right? Continuing here. So that would be urinary organs, organ of the urinary system. Reproductive system, cat, male, female? Male. Okay, so scrotum, testes, and we see here, this would be the epididymis. Okay, so the head of the epididymis here, the body, and becomes the tail. So then it becomes the vas deferens or the ductus deferens, and then travel in the abdominal cavity. So this whole sheet here is what we call the spermatic cord. It contains blood vessels and nerves, so we can see this blood vessel traveling in here. So this would be here the vas deferens or the ductus deferens. And the ductus deferens goes behind the urinary bladder and eventually enters the urethra as the ejaculatory duct. Okay, so on this one here, just identify the testis, the epididymis, and the scrotum in which they're located. And you can see here the septum. So we open one side, and the second testis is invisible because they are separated. And on a female cat, one of you may have a female cat, but we saw those with endocrine system. The uterus would be between the urinary bladder and the rectum. So here, something would be here, and that would be the uterus. From the body of the uterus, you have two extensions that form the horns of the uterus, and those ultimately attach here. And very easily we can confuse those horns of the uterus with the ureters. Okay, so here the ureters attach immediately to the kidney, but when it comes to horns of the uterus, they run laterally here, and you will see the pea-sized ovaries that are somewhere up here. So I can show you that on the dried cat. Okay, so 2 groups, station 1, 3, and 5 here. You form one group, and you work on organs, identifying organs of the respiratory and digestive system. So you take any cat here you like, and in the second group, station 2 and 4, you work to identify urinary and reproductive organs. All right.